Hey, what's up, guys? I'm here with Doctor of Chinese Medicine, Wesley Kress. Nice to have you, Wes. Wes is also a practitioner here at Arizona Aesthetic and Wellness. And today I wanted to talk a little bit about tissues and people's misconceptions when it comes to tissues, as far as most people get an image or something, they see something wrong, they immediately attribute that to their pain symptoms. And I know this is kind of a niche of yours that you like dealing with. So go ahead and speak a little bit about the research and kind of tissue healing and what you see in your practice.
Absolutely. So good to be with Dr. Ryan. Him and I share similar principles in terms of focusing on the nervous system, and the reason that is some of what he is mentioning right here in terms of the predominance in terms of how the nervous system affects pain and your capacity to do activity, whether that's playing sports or your day-to-day activities. And so a misconception that's essentially been continually perpetuated over the last decade, or actually a lot longer than that, is that if you have tissue damage, that means that you have to have pain, or that you can't actually do activity. And so we look at just back pain, because that tends to be a predominant issue. A lot of people will go to a medical doctor, get an MRI scan, and they'll say, oh, I have bulging discs, L5, S1, L4, L5. And while that's great, the statistic shows that 40% of the population have a bulging disc.
Yep.
And they don't have pain. So when we look at that, if the common denominator is, okay, you have some sort of bulging disc and you're having pain, and 60% of the population don't have pain because of that, that doesn't mean that the bulging disc means you have to be in pain. If you look at neck people have a lot of neck pain. Demolition derby drivers, they get hit 1,500 times in their career and constantly getting whiplash, and only about 2% of them suffer long-term pain in their neck. Then you look at shoulders. 1 in 5 people, even after having a successful surgery, still show some tear, and they don't have any pain, and they can still have full capacity to do their activities and so forth. So this paradigm that's been perpetuated in terms of okay, let's focus on the tissue, and if there's something wrong with the tissue, that means that validates I have to have pain there. And it's a misconception that continues, and the reason that is because if you look at sort of the overall approach to pain and injury, it's focused on the tissue, right? So surgery, if you go into a doctor, most likely you're going to have surgery, or a lot of times you'll have rehabilitation that focuses a lot on just tissue manipulation. And while that can be beneficial, you're sort of working at it at a very weak part, because it's the end point, right? So the tissue is controlled by the nervous system. So the nervous system is the master control. So whether or not you're going to have pain predominantly has a lot of things to do with whether the nervous system feels like you're having a strong level of communication to that area. So proprioception is very important. Whether or not it feels threatened in the area. So some of the stuff that Ryan does, some of the stuff what I do, is we're trying to reset the capacity for the nervous system to communicate to that area, so that it recognizes it is safe, and it removes some of the governing areas and allows you to perform without pain. So there's this thing such as tissue adaptation after an injury. And a lot of times what will happen is, you may have had an acute injury, you may have some sort of tissue injury, and the alarm went off. And that alarm, it serves its purpose, but with people in chronic injury, or chronic pain I should say, that alarm continues to go off. And that doesn't validate that there's still a problem with the tissue.
Because the healing process takes 6 weeks.
Right.
Maybe, inflammation goes 24, 48 hours. Healing process for normal tissue is around 6 weeks. So, you hit it right on. Like, people with chronic pain, like, they think there's still something wrong with that tissue. And going back to what you said with low back pain, with shoulders, with whatever it is, I think, one, we're in a society where people want results and an answer right now.
Right.
And in what we do, I think it's not so much a problem with like diagnosing someone, but treating them
Right.
for their entire condition. You know, so sometimes you might not get the diagnosis 100% correct,
Right.
but if you do a detailed enough examination, then, you know, sky's the limit as far as the rehab that you can
Right.
do and resetting the nervous system.
Right.
So talk a little bit about like what you do with these patients that come in with chronic pain and kind of how you educate them, because I think what's missed in manual medicine is this education process on what a patient's pain means, like, and just all of that.
Right.
That's just it's nobody wants to talk about actually the mechanisms behind what's going on with the patient, as opposed to kind of like this cookie cutter, like, oh, you have a disc bulge, let's go in and cut that out. Okay, you're fine now.
Right.
You know, but like you said, the brain still has that heightened sense that something's going on, and you know, what, like 80% of back surgeries are failed, where 5 years from now they're going back and getting another surgery. So what's your approach? And I know, like, on the other side of this, Wesley has a bunch of posters and everything up on education for his patients. So talk a little bit about how you educate your patients and kind of the approach that you take with them. Because chronic pain is way different than acute pain.
Oh, yeah.
And it's definitely a nuance on how you approach those patients.
Yeah, so it's a great point. You know, the way I try to explain to most patients is, you know, why does the nervous system exist and what is its primary purpose? Because once you understand that, then you can sort of understand what's happening in terms of the pain mechanism. So the nervous system is designed for survival, and that's its predominant reason. So it doesn't care, you know, if you can, you know, live pain-free or, you know, bench 300 pounds, 400 pounds, deadlift 500 pounds. It doesn't care. It predominantly just cares as to whether or not you survive. Now that can be somewhat problematic, especially with human beings, because we have a conscious mind that can elicit certain thoughts that are also nerve impulses that can trigger perceptions of threat. So the perception of threat is just as real physiologically as a real threat. And so you'll see this with people in their day-to-day lives, where people who are really highly stressed. Stress just means, you know, a threat to the nervous system. So, you know, your relationship, if it's very, very stressful, and, you know, you possibly could break up, what does that mean? Does that mean, you know, you're gonna be on the streets? I mean, there's a lot of things, at least psychologically, where that could be a perceived threat. And pain is simply a signal to have you change your behavior. And it doesn't necessarily mean it has to be tissue-based. So, for instance, you know, you can have work stress, career stress, you have relationship stress. Those are all threats. You'll hear people who are stressed at work, oh, I'm getting back pain now. What else is going on in your life? And so why do people tend to have the same pain in the same areas? It's because the nervous system is very efficient. So once it creates that neurological pathway, it's not going to recreate a new one. So, you know, you may have at one point had back issues, but it's just using that in order to change your behavior. So, you know, for instance, one I try to really educate people on is sleep. People in America average 6 hours of sleep. And they did a study where over 21 months, if you were averaging 6 hours of sleep, you were 1.7 times more likely to suffer an injury. So people are always looking to do, you know, acute injury, or excuse me, prevention in terms of, like, you know, foam rolling and all these other modalities, which, you know, can be beneficial to some degree, but, you know, here they are, they're sleeping 6 hours a night, they're eating right, but they're doing probably the worst thing they could possibly do, because 6 hours a night is as a perceived threat to your physiological well-being, and so that in itself can elicit pain. So, you know, I think people have this idea that pain is, you know, tissue-based, when pain is really an alarm. An alarm is what it is, and that alarm, you know, you can set off an alarm rubbing up against a car, didn't mean you break in. You know, some are more sensitive, and that's similar to how our own nervous system works. Sometimes, you know, people who have heightened levels of stress and their capacity to adjust to that stress depends on their nervous system health. And if their cup, as we call it, if it's overflowing and they get some sort of additional stressor, that could be physiological, that could be you're running in a certain way, that could be not sleeping, that could be relationship, career stress, that could be physiological stress in terms of like diet related. So some people have intolerances if they're eating those. Those are also can elicit pain signals, but those aren't directly related specifically to your area that you're experiencing the pain. So that's a key way to understand pain is to look at it from, what is it doing? It's first of all, it's trying to change your behavior. So what in your life, are you doing that maybe, causing that? And some of it's within our control and some of it's not. But we can sort of change our environment. We can change some of those areas so we can lessen that. So the way I work with patients in terms of helping remove that pain, we get a detailed history in terms of what are those areas, what do they look like, what are the factors that may be adding to their pain, and fortunately we run through a full gamut of muscle testing, and then we run through a diagnostic process, and this is with the new fit, and the new fit's obviously very, very different because most neuromuscular electrical stimulation, it predominantly runs on a motor signal. So that motor signal it's firing the muscle, and cool, that's great, but that's predominantly motor efferent signal that's going to the body, and not sensory afferent. And so sensory afferent, that's basically sensory input that's coming to the body, going up the central nervous system, and it's providing information to the nervous system in terms of integrating, processing, coordinating, and then it's going to elicit a different response in that area. So we're re-educating the body as to how to fire and how to handle those additional stressors, even if it's elicited in that area. So even though we may be, for instance, we go through the scan process, a lot of people are surprised that sometimes it's not in that exact area.
Right.
But I'm sure you're aware of, just because you had pain in an area doesn't mean the problem is in that area.
Yep.
And so once you correct it, it goes away.
Yeah.
Probably the most fascinating case, we had was a paraplegic in the Austin location.
Yeah.
26 years, she, had no sensation, no movement, not able to walk. But when they first did the scan process on it, she felt nothing. Except for in two areas, she thought maybe she felt a hint. They anchored to those areas, and then she started feeling a twinge in her hip flexor, anchored to those, and then it broke it open.
Yeah.
But it's just very interesting how the nervous system is very systemic. So sometimes, again, we get into this localized area. This tissue is my problem. And again, you can have certain levels. Pain can be mediated on a number of different ways. So for one, it can be mediated through threat that we're talking about. It can be mediated through inflammation.
Yep.
It can also be mediated through neurogenic inflammation, which is just that nerve is just firing. And it can be idiopathic, meaning there's nothing really wrong in the area, but it's signaling that alarm, and that can continue to elicit pain because of the inflammation.
Well, it could be, like nerves like the rest of your body have to move, right? So, I mean, you have a container that holds the nerve, and then you have all the muscles that the nerve has to run through. And either one of those could cause inflammation on a nerve if it's not moving properly. So I think the biggest thing for people is, especially in my profession as a chiropractor, imaging is almost used as a scare tactic for people. It's almost like, hey, do you see this right here? This is what's wrong with you. This is what's causing your pain. And it's like, no, like maybe, but not really, and the biggest one is in chiropractic, like not to bash my own profession, but it's like the reverse cervical curve. Mm-hmm. Like no research out there says that having a reverse cervical curve has any effect on pain symptoms in the neck, or that you can go to a chiropractor and it'll change.
Right.
So like that's where it comes down to, like, doing a good detailed exam, I think, is the best thing that you can do for the patient, even if you're the one that treats them or not, but going through every system of the body and really making sure, because I mean, you could have low back pain, but the problem could be your foot is just jacked.
Right.
So, and it just goes back to education, man. Like, being a doctor is being able to educate. Like, that's what it is.
Yeah, I mean, and actually, the I believe it's the Latin meaning of it was to teach. That was actually the root meaning of doctor.
Yeah.
I have to look that up, but I'm almost 100% sure that that was the root meaning of doctor. And now, obviously, it's lost its whole facet. I mean, most doctors are not teaching; they're
technicians.
Technicians, yeah, if anything, and it's definitely difficult to see the scare tactics in terms of people get an MRI and the first thing you want to show me is looking at it, and it's not that piece of the information is not something we take into account. But again, most of the new research on pain, if your physician is staying ahead of the new research, and I will admit, it takes 17 years on average for new research to make it into clinical practice. And so this is why some of what we're talking about today, because both of us are very passionate about what we do, we stay up on the latest research and provide that to our patients. Most people out there are not providing this. And so they're predominantly in the old paradigm of thinking that if there's some sort of physical problem, and I really want to specify this in a chronic pain issue. If it's an acute tends to be a little bit more accurate, but acute can morph into chronic as well if it's not correctly handled. But in chronic pain issues, I have patients all the time that show me that's predominantly all in their mind, like, oh my God, I'm never going to be able to do it, this again. Or,
well, it's the fear avoidance too.
Right.
Like there's so many physiological and psychological things that go into someone's pain, and I think you just hit on a huge one right there with fear avoidance. Wesley and I are going to do a couple of these probably, because we could sit here and talk for an hour just about this stuff, but this is kind of an intro into pain and kind of how you need to be able to classify what's going on with your patient and put them into a category so that you can get the best results possible with them. So do you have any last thing here, like any resources for people that watch this as far as getting up on this? Like mine would be Butler's book, Explain Pain.
Mm-hmm.
Like I think for a patient, it's broken down very easily. You can understand what's going on. So for me, that helped me when I was going through school, kind of go through that. So for you, what would you say is your number one resource for?
In terms of resources, I've spent so many years in so many different areas of filtering through research studies, not just books that have been published. In terms of something that I would recommend is I would sit down with yourself and ask these questions. I would ask how closely does your life mimic natural patterns of nature, because those are going to give you insights as to whether or not your physiology and psychology is feeling threatened by certain things in the environment and eliciting those stressful responses. Because for instance, we touched on sleep, but it's like I think 50 to 60 or 70% of people who are shift workers have like a 60 or 70% increase in every chronic disease. And there's a reason for that. Again, but you ask the person who's doing shift work and they think like, well, I'm sleeping 8 hours. But that circadian rhythm, which is getting information from the environment through your eyes, hitting the suprachiasmatic nucleus and causing a cascade of downstream physiological reactions, if you don't understand how that is fitting into nature, then you're probably naive to the fact that these choices have a huge effect on your pain and your overall health. Because again, pain is an alarm, and that alarm can get set off by any sort of divergence from a natural way of living. And most of our life, I guess, some of what we forgot. So like, we get exposed to blue light at night, and that suppresses melatonin, right? If you're not living in a room that's completely blacked out, you're suppressing your melatonin to some degree. If you're not getting exposure to sunlight in the morning, you're not producing enough serotonin. And again, these seem like no big deal, but when you look at like 90% plus of people are not getting exposed to normal daily light because we're in office buildings all the time and so forth. Like, you may not think about this in your day-to-day life because this is so normalized to us, but our world in general is not natural and from the standpoint of how our body was designed. So it's not that we need to go back to that, it's just we need to use strategies that mimic that same natural rhythm so that we don't have these threats coming in and these alarms going off that causing pain either systemically or locally. And so, that would be my biggest thing, is to have people, because people don't often think about from that perspective. And perspective is fairly powerful from the standpoint of, am I getting 8 hours? But am I getting, from 10 p.m. to 6 a.m. or am I getting from 12 or 1 a.m. to 8 a.m.? Because you're missing a couple hours of growth hormone exposure. You're added stress hormones. You're reducing certain hormonal outputs because only certain things can get released based on information from the environment. That's why like serotonin or melatonin may not get converted or may not get produced unless you get certain external cues.
Right.
So we're constantly getting information from the environment. And so you have to ask yourself, what information are you giving your body? What type of information are you getting from your relationships, your financial situation, your career, and then your natural circadian rhythm? Like how much of those are based on a healthy way? This isn't like a single thing that you do. I mean, most people are looking for the one thing that like cures everything, but it's the it's the sustainable way of living that allows you to live healthy and fulfilled, and that's in every facet. And so if you can find how to align yourself to a circadian rhythm that aligns very closely to nature, and those areas of your life are healthy, when you go next time you're thinking like, I'm going to buy this new car, and you may not think about it from a health perspective, but those extra payments, are they going to cause or elicit stress that may downstream affect pain in your body? I mean, it can definitely. We know that it is not as pain is a very complex thing, and people want to isolate it down to tissue, and it is. The research doesn't show that at all. So that would be my recommendation is to sit down with yourself and ask yourself, look at how many things are in accordance with natural law. And if you need help with that, Ryan's here, I'm here. We can both talk with you probably a lot about that.
Yeah, so just to go through like a recap of this, so pretty much we talked about how pain doesn't necessarily mean that something's wrong with the tissue, especially in chronic pain. And then we just you detailed a little bit about just one big thing that I think a lot of people don't do well is sleep, and how that can affect your body. So like I said, Wes and I are going to do a couple more of these probably. Like this was fun just to sit here and talk about how we like to help people. Obviously that's a passion of ours with what we do. So if you stuck around for the whole thing, thanks for watching, and we'll be back next week.
Awesome.